Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. This week we hear from Dr. Jane McElroy. She's a professor of family and community medicine at the University of Missouri and specializes in LGBTQIA health care. She spoke about some of the common barriers and difficulties that LGBTQIA patients can encounter when accessing care. Here's Dr. McElroy.
I think the biggest thing that is unhelpful is the unknown for the community. And so if you need to see a doctor, you don't know whether that person will accept you or not. And so you're sick, you don't feel well, or you just need to do preventative care and you don't know if they're going to absolutely reject you and say, I don't treat this kind of person. And so there's that unknown. You walk in and you don't know how you're going to be treated. And sometimes it isn't the physician, it's the frontline staff, or it's the nurses, it's all the other people you interact with. Because it's rare to go into a healthcare system and you just see the one person. You often see multiple people, and every single one of those people can have their own issues or own biases that come out in very unhelpful, mean ways. So I think that's one thing that really reduces the ability of people to be comfortable seeking health care when they need it. So I think that's probably one of the barriers. There's the barrier about people just not getting you. It makes one weary when everybody uses the heterosexual normative language. If I'm a female, clearly I have a male partner. If I'm a male, I clearly have a female partner. And just making those assumptions, and it just gets tiring. It's very rare for the healthcare system to ask the person their sexual orientation or gender identity. Gender identity is a little different, but for sexual orientation, it's rare. It's almost always the patient has to be the one that outs themselves. Well, again, that gets really old. How many times? And the whole thing about the question about when did you come out is sort of kind of a humorous question because people have to come out almost every day, right? So, and then when was the first time you came out to who? To my best friend, to my family, to my work. They all vary, and some you're not out to. So it's a very naive question to ask that. In the healthcare system, the burden of sharing that vital information is placed on the patient. And that's one of the few times where I can't think of another situation where the burden of disclosing vital information is put on the patient. Even if someone says, I'm okay working with LGBTQ population, I'm fine, there's a sense about kind of the startled reaction about, well, what am I supposed to do with this information? And then the classic, well, I treat everybody the same. It's like, well, that actually isn't, the point is that telling you that I'm gay wasn't to be reassured that you're going to treat me okay. It was to let you know that I may have different needs. And clearly you have no idea that there may be different needs that I have that a straight person doesn't have. Because the response is, well, I treat everybody the same. Well, we're not the same. We have different needs.
That was Dr. Jane McElroy speaking about difficulties LGBTQIA+ people can face when accessing health care. That's it for this week's Missouri Health Talks, which was reported and produced by Anna Kaufman. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.